Welcome to this episode of DMC Medical Matters. With us is Dr. Patricia Uddyback. Dr. Uddyback is the Vice President of Academic and Community Affairs at the DMC, and she is an emergency medicine physician. Dr. Uddyback, let's start with a basic question. When should people come to an emergency room for treatment?
Well, people should come to the emergency department when they're having chest pain, anything that's persistent, ongoing shortness of breath, persistent abdominal pain that's not relieved with, say, an antacid or a basic Tylenol, or fevers, chills, general things, weakness. We're seeing a lot of people delaying care and putting things off because they're afraid to come to our emergency departments because of the COVID-19 virus. But what they are doing is really setting themselves up for a worse situation down the road. So we are really strongly encouraging patients not to wait. Our emergency rooms are safe. Our hospitals are safe. We have implemented a lot of safety measures to make sure that we're doing ongoing cleaning and desanitization of all of our areas. So people need to feel comfortable coming in when they need to come to see a physician.
Now, when people come to the emergency department, it's a very stressful time. As a care provider, how do you help them and their family cope with that and get them through that process?
Well, there's a couple of things that I do. One, you have to make sure that you are engaging the patient where they're at. When they're coming to the emergency department, they're not always prepared. That wasn't how they started their day. Oh, I'm going to the emergency department. Something unexpectedly happened. And so you have to really meet them there, and you have to be patient as a provider. Two, you have to engage with all of the key stakeholders in their lives. Typically, if it's a husband, you got to talk to the wife. And if it's a older senior citizen, you got to make sure that you're talking to any key caregivers. You cannot leave that history out, because 9 times out of 10, they may not tell you all of the dynamics of what's happening with them. The last thing I really like to do is make sure that I communicate with them from the beginning to the end and throughout the entire visit, making sure that they're kept abreast of what's happening, what the results of tests are showing, and making sure that they understand the dynamics of what's happening before they leave. And then the final thing I always try to do, even though I have a short moment of time with patients, is provide any kind of level of education that I can. If they're coming in and their diabetes is out of control, I try to do my 2-minute spew on what you need to do to control your diabetes. So those are the kind of things that I think help make that experience a little bit better.
So you just talked about the compassionate care. Tell us a little bit about the expertise of the staff at the DMC and how important that is for the patients you treat.
Well, the staff at the Detroit Medical Center are the best. And I'm a little biased. I've been here for a while, but I can tell you I've seen them rise to the occasion over and over again to take care of the Detroit community, to make sure that we work as a team in providing care. We have the best experts here. People come from all over to come see physicians and specialists at the Detroit Medical Center, where we get referrals from all over the Metro Detroit and Michigan area for a lot of our experts. So I think people can feel comfortable that they're going to receive the absolute best care possible whenever they step into a DMC facility.
All right, thank you for the insight, Dr. Uddyback, and thank you for watching. For more episodes of DMC Medical Matters, visit our website at dmc.org/medicalmatters.